Hey everybody, just wanted to do this video blog and talk about heavy metals. Not the bands, not the music, but heavy metals such as lead, aluminum, arsenic. I've been seeing a lot of patients coming into the office and they're testing positive for lots and lots of heavy metals. So that's what I wanted to talk about today, and the rampant damage that it's doing upon our bodies. I had a research paper recently pass across my desk, and I've been reading through it. And let me just read it to you guys. It says, there's ongoing research showing heavy metals are a constant threat to our health. Dr. Gary Gordon states research supports almost everyone has 1,000 times too much lead in their bones. He says the reason that lead and mercury are coating the world today is because we burn coal to produce electricity in the United States and China and many other places. He feels that all causes of morbidity and mortality are tied directly to how low you keep your lead levels throughout your life. Now, lead was a big thing back in the 60s and 70s when they used to use leaded gasoline and paints, and we've all heard the news reports of lead-coated paints coming out of China in the toys. So this is a real big issue. Lead in bones cannot be removed faster than bones remodel, which takes about 15 years for adults. Many researchers state lead contributes to earlier cataracts. They're finding mothers pass lead and other toxins to the fetus during pregnancy. Studies show that children are born today with at least 200 toxins that can be measured in their blood and tissues, and that many children are born with elevated mercury. Studies now indicate that almost everyone is born with elevated lead levels. It seems safe to say that these toxins are adversely affecting our physiological and physical health. Most doctors are treating the symptoms of named and blamed diseases with drugs that very may well have one of their underlying causes being heavy metals and other toxic accumulations. I don't know how many people I see in practice every day that has some type of lead, mercury, aluminum, arsenic toxicity in their body. And when we talk about toxicity, it's not so much in the sense of poisoning, which is getting an overabundance of these toxins at one period. We're talking about an accumulation over time. So this is an accumulation over years upon years upon years, and it wreaking havoc upon your biochemical makeup. So, I mean, you look at this, when it states that many researchers state lead contributes to early cataracts, and that they're finding that mothers pass the lead and other toxins to the fetus during the pregnancy. And we look at the increase in all these childhood diseases, the increase in autism and all that stuff, and there's a lot of research out there that is trying to blame one thing. They're trying to blame just vaccinations, or they're trying to blame radiations and all that kind of stuff. But in my opinion, it's not just one thing. It's an accumulation of all of these aspects. Depletion of our soils and nutrients, and depletion of other nutrients from farming methods, the ubiquitous toxins in the air, and like the research says, heavy metals and all that stuff, really, really rampant in our society. Some of the things that I do in the office with people who come in as being sick and toxins being the major issue in their life is we start off with, one, identifying what toxins are there, and then creating a treatment protocol that helps to remove the toxins from your body. A lot of times you cannot jump straight into a detoxification program, however. A lot of times, people want to do these detox programs right off the bat. They read on the internet and they find, the master cleanse or whatever, and they're not downing these cleanses. They do work, but there's a time and a place and an order that you need to do these things. And my opinion is that everything is going to be going out somewhere, and there's three main routes of detoxification that I look at. One is through your bowels, the other is through your urine, and the next one is through your lungs. So those three major aspects have to be functioning properly and able to detoxify properly. So you have to look at your liver, gallbladder, your gastrointestinal tract, your kidneys, how well you urinate, and also how well you exhale, inhale air, and move things around. So we look at all those aspects, and then we formulate a treatment program to help you to remove those aspects on a structural component, making sure that everything is balanced neurologically and biomechanically, that your spine, extremities, everything is moving properly, so that you don't have to expend energy and keeping your body straight. That energy can be expended towards detoxification. Then we also use homeopathics, other things like metal chelators to get the body out. And through this process, we've had a lot of success from with people who've suffered from heavy metal toxicities. So, if you like to consult with me, just mention that you saw this video, and I'll be more happy to do a complimentary consultation with you. Just call the number right at the bottom of your screen, 949-559-7999. Ask for Dr. Mike, and I'll be able to help you out. Even if you live far away, we can do an over-the-phone consultation, can set that up, and get you started to better health and wellness. With that, be well.